More women are seeking care for issues like hormones, weight management, and menopause, but new research suggests many still feel their concerns aren't being addressed as a whole. So joining us is Dr. Janelle Duah of Maven Clinic to discuss new findings about the gaps in women's health care and what can be done to improve it. Doctor, thank you so much for being here.
Yes, thank you for having us.
So good to have you here. So many women struggle with issues like weight changes, hormones, PCOS, or menopause. Why is it often so difficult to get clear answers in coordinated care?
Yes, and I can attest to this as both a patient and a physician. As a patient, I have PCOS, now known as PMOS, and I've been living with this diagnosis for over 20 years. And in those 20 years, I have had to navigate from doctor to doctor within our traditional healthcare system, really trying to understand, are my symptoms random? Are they connected? Are they part and parcel of an overarching issue? And finding it really hard to find a provider who could help me put together those puzzle pieces and answer those questions for me. On the physician side, we have found that up to 20% of providers really do admit that there's a training gap, especially when it comes to menopausal care, but that can be extrapolated to women's health in general. So it's really hard for women to get answers because they're having to jump from provider to provider, really feeling that tension where the providers don't feel adequately trained to really manage the symptoms for which women are coming to them for.
Oh, wow. So as you mentioned, you've experienced this yourself. How has that experience shaped the way you think about women's health care?
Yeah, so having to navigate the healthcare system with my PMOS diagnosis really ingrained a passion in me for doing things differently, not wanting to feel, have other women feel that they have to jump from doctor to doctor in order to get answers. And that's what really drew me to Maven. At Maven, our motto is to provide comprehensive, holistic care for women and their families, and being that hub where women can really feel that they can trust their providers, that their providers are listening, that they are really asking those deeper questions that help them to understand not just what prescription or medication might be right for the woman, but how it will really fit into their lifestyle, into them understanding their bodies, and helping them to address their health in a way that lets them thrive and not just survive.
And for women who feel frustrated or unheard when it comes to their health, what should they know and what can they do to advocate for themselves?
Yes, first and foremost, I want women to understand that we should really trust ourselves and listen to ourselves. We have a really great inclination for understanding when things might be off or might be wrong, and we really should make sure that we're not pushing our concerns to the wayside. We should really be trying to find providers that really listen, that really care to understand our lived experiences, that really want to give us clinically sound and evidence-based recommendations that fit our lifestyles. Classically, that might take a second opinion, a third opinion, but this is really where Maven shines. We offer that virtual comprehensive care right at your fingertips. So I want women to understand that they really should trust themselves, trust what they're feeling, and find providers like we have at Maven that really want to help them put together those puzzle pieces.
Wonderful. Dr. Duah, thank you so much for joining us and for sharing these important insights.
Perfect. Thank you.